Today's topic is anatomy of wrist joint. Type of wrist joint. The wrist joint is a synovial, ellipsoid joint that connects the forearm to the hand. It allows flexion, extension, radial deviation, ulnar deviation, and circumduction. Bones of the wrist joint. The wrist joint is formed by articulations between the radius, ulna, and carpal bones. A. Forearm bones. Distal radius, the primary articulating bone of the forearm in the wrist joint. Distal ulna does not directly articulate with the carpal bones, separated by the triangular fibrocartilage complex. B. Carpal bones. Scaphoid articulates with the radius, most commonly fractured carpal bone. Lunate central carpal bone articulates with the radius. Triquetrum articulates with the TFCC and helps in wrist stability. Pisiform, a sesamoid bone embedded in the tendon of flexor carpi ulnaris. Bones forms the joint. The wrist joint is composed of multiple joints that work together to allow complex movements. There are three primary joints within the wrist. 1. Radiocarpal joint. Type: synovial, ellipsoid joint. Articulation. Proximally, distal end of the radius and triangular fibrocartilage complex. Distally, proximal row of carpal bones. Movements: flexion, extension, radial deviation, ulnar deviation, circumduction. Second joint is midcarpal joint. Type of joint: synovial, plain joint. Articulation between the proximal row and the distal row of carpal bones. Movements contributes to wrist flexion and extension. Third joint is distal radioulnar joint. Type of joint: synovial, pivot joint. Articulation between the distal radius and distal ulna. Movements: pronation and supination of the forearm. These joints work together to provide the wrist's wide range of motion while maintaining stability. Ligaments. The wrist is stabilized by strong ligaments. Palmar radiocarpal ligament prevents excessive wrist extension. Dorsal radiocarpal ligament prevents excessive wrist flexion. Ulnar collateral ligament provides medial stability. Radial collateral ligament provides lateral stability. Intercarpal ligaments connect carpal bones for additional support. Muscles of the wrist joint. The wrist joint is controlled by extrinsic muscles originating from the forearm. These muscles are categorized based on their function: flexors, extensors, radial deviators, and ulnar deviators. Flexor muscles. These muscles bend the wrist forward. Flexor carpi radialis flexes and abducts. Flexor carpi ulnaris flexes and adducts. Palmaris longus assists in wrist flexion. Flexor digitorum superficialis primarily flexes fingers but assists in wrist flexion. Flexor digitorum profundus assists in wrist and finger flexion. Flexor pollicis longus flexes the thumb but also assists in wrist flexion. Extensor muscles. These muscles bend the wrist backward. Extensor carpi radialis longus extends and abducts the wrist. Extensor carpi radialis brevis extends and abducts the wrist. Extensor carpi ulnaris extends and adducts the wrist. Extensor digitorum extends fingers and wrist. Extensor indicis extends the index finger and assists in wrist extension. Extensor digiti minimi extends the little finger and assists in wrist extension. Muscles for radial deviation. Move the wrist toward the thumb side. Flexor carpi radialis. Extensor carpi radialis longus. Extensor carpi radialis brevis. Abductor pollicis longus. Extensor pollicis brevis. Muscles for ulnar deviation. Move the wrist toward the little finger side. Flexor carpi ulnaris. Extensor carpi ulnaris. Joint capsules. The wrist joint has a fibrous capsule lined with a synovial membrane, which produces synovial fluid for lubrication and smooth movement. Blood supply. Radial artery. Ulnar artery. These arteries form the palmar and dorsal carpal arches, supplying the wrist and hand. Nerves. Median nerve anterior aspect of the wrist. Ulnar nerve medial aspect of the wrist. Radial nerve posterior aspect of the wrist. Movements. The wrist joint allows movement in multiple directions due to its ellipsoid shape. Flexion, bending the wrist forward. Extension, bending the wrist backward. Radial deviation, moving the wrist towards the thumb side. Ulnar deviation, moving the wrist towards the little finger side. Circumduction, circular movement that combines flexion, extension, abduction, and adduction. Thank you for watching the video. Please like, subscribe and share the video.